Hi, it's the Chappiness guy. Welcome to today's episode of Vestibular Talks. Today's special guest is Dr. Cheryl. Dr. Cheryl is a certified vestibular physiotherapist doctor that has a website called Healing Vertigo, where she educates others, both patients and medical practitioners, about vertigo and also dizziness conditions or vestibular conditions. Mostly, she discusses Bppv, but she's got vast knowledge in other vestibular conditions as well. I hope you enjoyed the episode. Remember to like, share, and subscribe. Find your championess, guys. All right, we're recording. How are you today, Dr. Cheryl? I
I'm very
call you doctor. I
good.
call you doctor.
I don't mind it. I'm really great. How are you?
I'm great. I'm great. Thank you for taking the time to chat with us in this episode of Vestibular Talks. Really appreciate it.
Oh, thank you for having me. I feel honored that you asked.
Awesome. All right. I still want to call you Dr. Cheryl. Is that okay?
That's fine. You just call me Dr. Cheryl.
Okay. All right, Dr. Cheryl. So, what can you tell us about you? Tell us a little bit about who you are, what is it that you do, and how your journey with this vestibular uh, universe began.
Yeah. So I'm a physiotherapist from Hamilton, Ontario, in Canada, and
Yeah.
I did my Canada. And so I did my undergrad or I did physiotherapy, and I got a job in a clinic that had a vestibular therapist in it. And so really interested in what she was doing. But at that time in school, like vestibular therapy wasn't even really taught. It wasn't introduced even in school at that time, only 10 years ago, but still. So this vestibular therapist was sort of something that was new and different. And so I really kind of was drawn to her and drawn to what she was doing. And I tried as often as I can to kind of sit in on assessments and learn a little bit. But then she left. But there was a whole lot of patients that were still being referred to the clinic. And so I kind of thought this was an opportunity. I was only 1 year to school, but I thought, let's dive into this world of vestibular rehab. And so I started taking some courses and just started seeing these patients. And really between courses and patients, because patients teach me more, I think, than courses sometimes, I started to learn a whole lot more about this whole about vestibular rehab, and I just fell in love with it. I loved treating patients. I loved the conditions. I loved just understanding more about the vestibular system, and so really kind of took any course that I could in Canada. I kind of was trying to get my hands on anything that I could. Kind of exhausted what we had available in Canada, and so I ended up going down to the U.S. and I took the week-long course at Emory University, which is a fabulous course for any other healthcare provider out there listening. And that kind of really, I think, established kind of my true love for vestibular rehab. And so from there, I just kept going. And so yeah, I've been treating vestibular rehabilitation now for over 10 years. But a little side thing for me and kind of what changed a little bit for my life and what ended up leading me down a specific road that I'm on now is that a couple of years ago, my husband and I thought, you know what, let's just take a break. Let's go sailing. And so sold our house, bought a sailboat, and we took off. And we sailed from Hamilton all the way down to Grenada. It took us a full year, amazing adventure. And then we kind of thought this was fun. Let's kind of keep this going. And so we kind of did halftime on the boat in the Caribbean, halftime back home in Canada working, and everything was going great. But then COVID hit, and then things changed a little bit. You got to get flexible when COVID comes.
Yeah.
But what changed my mindset about so many things is that I was a vestibular therapist in a large city, and I was helping lots of people, and I felt really great. And I thought, yes, we're getting out there. We're tackling the vestibular world. We're helping people. Yeah, as soon as you leave the large metropolitan area, it becomes incredibly obvious that access to vestibular therapy and a specialized therapy is really a privilege that we have being in big cities. It is not available everywhere, and being able to access something like that really drastically changes. And I mean, I put myself from a large city into quite a small area. I mean, we're going through tiny little islands in the Bahamas and down through the West Indies and the Caribbean. And so it really opened my mindset into the fact that, you know, there's healthcare varies a lot in the world. And at first I thought, well, maybe I can kind of, you know, how can I kind of keep using my knowledge as a vestibular therapist down here? But all I had really experienced was just one-on-one care. This is kind of what we did for years. We just, patients, you know, has an injury, comes and sees me, we work together, and that's it. And they have to come into the clinic. I have to use all my tools. And that's kind of just how I treated. And so through traveling, it kind of got me thinking, like, what else can we do as vestibular therapists? How can we use our knowledge and share this knowledge in other ways? And so that's kind of got me down the road of creating Healing Vertigo, and getting more into like increasing access of Bppv treatment for patients and for healthcare providers to use who maybe aren't vestibular specialists, to really help address treating these conditions kind of anywhere now, not just, you know, you don't have to either refer away to me in a large area. You can either take it on as a healthcare provider regarding your doctor, your physio, you're a nurse, anything. Or you're a patient who's just, you know, has recurring Bppv and you want to kind of get treatment. And so we can get into kind of Healing Vertigo in a little bit, but that's kind of what got me here. And so that's kind of what created Healing Vertigo. And I'm on a boat right now as I'm talking to you. So I'm still doing this all, you know, we're kind of living, you know, that remote life at the moment. But I think this is what's also so great about what you're doing with your channel, is that information can be accessed and can be shared now everywhere. And it's very cool. It's very, very cool to be able to share this more, I think, this way.
Yeah, your life story is quite interesting. And also the fact that you're traveling around the world, like the Caribbean right now. I'm jealous, by the way, that you're able to go to these nice, amazing places and have the independence of basically still work and help people wherever they need it, but be able to like go in this giant adventure on a boat. Like it sounds like a movie. It sounds like, I think you're like the first person I've met that has done something like that. So that's awesome. Like that's very, very cool. Now that people have more access to the internet, to things like this, with your page Healing Vertigo, is telehealth a viable option for people? Like, let's say that someone that cannot come and see you in person, could you do like video sessions with them in order to tell them, hey, maybe this positioning of your head might be able to help you, or where you can assess whatever symptoms they might be having in order to maybe diagnose or help them, kind of like give them an idea of like, this is what you may have?
Absolutely. So telehealth is something that I'm doing, but in all honesty, it's a small part in a way, because I can only still help people in Ontario. That's where I'm licensed to treat. And so we kind of loop back around to that same problem where you're like, great, I'm everywhere, but unless you go get a visa in every single country, you know, you're kind of limiting. And so to kind of introduce sort of another field that got me thinking. This is kind of what got me thinking, right? Like, I went the same route. I'm like, okay, telehealth, that's gonna be what I'm gonna do, and it's gonna help everyone. And I do that, and I still do help people in Ontario, but I still recognize I'm sitting here, I'm meeting all of these people. I'm meeting healthcare providers who want to know more about vestibular rehab. I'm meeting just like, you know, people in the community that are still going like, well, what do I do, right? So that's kind of got me on two different avenues. And so I teach now. And so I've created courses to help teach other therapists about Bppv. And that's not really that new. You know, like a lot of people, you can go out and do courses. But the second avenue that I took is thinking about, okay, well, let's look at all the different conditions that you can have for dizziness. And you know, I think we can all agree Bppv is kind of that really common one, right? It's the one that when you look at vertigo, it's usually the most common cause of vertigo and dizziness. When you look at people as they age, 1 in 10 people over the age of 65 just have BPPV, often undiagnosed. It's really, really common. And although BPPV is something that is benign, it won't kill you, it has consequences. When you are dizzy and you have balance issues, it leads to falls, it leads to reduced ability to just do activities, it leads to very sedentary lifestyle. And so it has consequences beyond just itself. And I think that's why it's so important to address it and treat it as quickly as we can. And so, actually first, before I get into it, do you want me to go over what BPPV is a little bit?
We will get into it. We will get into it because I have a story for you that will lead into BPPV.
Okay. So anyways, that's it. So I'm thinking about BPV. I'm going, this is the condition that I think would make the biggest impact when it comes to more of a global way to improve access to vestibular rehab. You know, if you still have vestibular neuritis or Meniere's disease or a migraine, I think you do really need to be a one-on-one with a vestibular therapist, have a healthcare team, no questions on that one. But BPPV is something that I think is so common, is so underdiagnosed, and is so treatable that I really wanted to introduce this concept of let's maybe take away the vestibular specialty when it comes to BPV treatment. Let's break that mindset that you have to go and see a vestibular therapist. Can your doctor treat this? Can it be treated in the ER at different things? And so what I looked at was like, how can I kind of now create like a resource for people to use? And my initial mindset was for the healthcare provider. So what I first did is that throughout my travel, I kind of kept coming across people. You have the same conversations. Oh, where are you from? What do you do? And so you tell them that you're a therapist that treats dizziness, and you have the same conversation because somebody's like, oh my gosh, oh, I know somebody who's dizzy. Or, oh my goodness, can we talk more? Can we, you know? So it became really obvious to me that there's like, you know, a lot of people who are having BPPV, other sailors that I was meeting, things like that. And I wanted to kind of have a way of helping them, but we were all transient. We're all taking off sailing this way or that way. We weren't in a position to follow up and help. And so you go to the internet, you're like, okay, well, what other videos are out there to find that are really good? And I found some fantastic videos, but I think I found some horrible videos. And I knew which were good and which were bad because I'm a vestibular therapist. But I kept thinking, well, do my patients know what's good and what's bad? How do people figure those two things out? They don't in the end. They just kind of end up grabbing different things. And so I thought, well, I'm going to make for myself a whole bunch of videos that I know are going to be what I want my patients to see. And I can then just send people these videos. And that's what kind of got me thinking. I'm like, but they still need me. They still need the logic flow of the practitioner to put the diagnosis to the treatment. And so that's what then, you know, once I created the videos, I thought, let's see if I can kind of, you know, create something that connects people along the way. And that's kind of how the app ended up getting developed. Is like, okay, well, can I put my logic flow of what after I do this test, here's what I look for. Based off of the answers to those questions, I come up with a diagnosis, and then I know which maneuver best treats that diagnosis. And so we put that logic flow within an app. And so now, like, a healthcare provider can use that app with kind of the assistance of that little bit of extra knowledge from a vestibular therapist to be like, okay, what do you see? If you see this, you go this route, and so on and so forth. But I developed it also with the mindset of going, I don't know who's going to buy the app. So I made it also patient friendly. So I made it sure that if a patient were to pick this up, it also could totally work for somebody who is not a healthcare provider as well. So it kind of, you know, just sort of bridges, and the goal was to bridge that gap between like the internet and like a certified healthcare vestibular therapist. You know, like there were two options at that point and nothing in between, and the gap was large. And so that was kind of the idea, is to create something in the middle. So either like another healthcare provider can use this tool. They may not be specialized in vestibular therapy, but they can use the tool to help them. or a patient has something a little bit better than just whatever they're finding online, to kind of help that guidance. And so, yeah, so that's kind of what I've done the last year, is really creating that Healing Vertigo app to help people just treat BPV, because I found that it was so common, and we just wanted something else between the two things.
Would you ever consider, Dr. Cheryl, having maybe like within the app, a ramification of, for example, if somebody lives in Calgary like me, that your app, if you have another vestibular physiotherapist that is associated to you, that lives in Calgary, maybe they will me as a patient will be able to find that person through your app. Like your app will direct them to other people, so that way you can create kind of like a old kind of network type of thing.
So in the app, I have a link to Vita's healthcare provider directory. So within the app, you kind of say, okay, like, so if you go through the app and you go, and basically you go negative, 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 and we cut at the end and go, you don't have BPPV, right? So like, this is not what's working for you. Or you do the results and you're still dizzy, you've done it once or twice and you're still dizzy. That's where I connect. I actually just have people to Vita. I think it's the best resource. And most vestibular therapists are registered as a healthcare provider on there. And so that's kind of like the link that we put. So it's too hard to like truly embed like a specific contact of somebody. But I think connecting people to Vita's healthcare provider directory, no matter where you are, you're going to now find the therapist in your area. So okay. I didn't want to leave people kind of like off on their own. Yeah.
Oh, that's awesome. Dr. Cheryl, now the story that I had for you is, okay, so first of all, I'm extremely grateful to God that doctors of vestibular physiotherapy like you exist, because many other practitioners, like a general practitioner doctor or even the doctors from the ER, I mean, God bless them, but a lot of times they don't want to deal with dizzy people. They are like, oh, fuck, like this guy, sorry, I swear. They are like, this guy dizzy, we don't know what to do with. So they kind of don't know what to do with you. Like they kind of just pass you around to see like what they can do. So I'm extremely glad that you guys exist. Also, dizziness and vertigo are many things can cause dizziness and vertigo, and it's not pleasant at all. As you said, many of these conditions change the quality of your life, because you when you're dizzy and you have vertigo, you can drive, you probably can be out in public, you can fend for yourself because you're trying to crawl around, trying to find the bathroom because you're nauseous, you're sick, your world is spinning. Like it's a very, very debilitating sensation. And people don't really get it until they experience it themselves. So interesting enough, my mother, even though she's been dealing with me for the last 2 years with these vestibular migraine things, she always said, I don't know how to relate to you, son. Like, I know you're suffering with this, but I don't know how to relate. She had an episode of vertigo a couple of weeks back for 3 days. So she started getting anxious. She was having a panic attack. And I said, Mom, calm down. It's most likely Bppv. She's like, what the hell is that? And I said, just relax and calm down. So she ended up going to the ER. The doctors didn't know what it was. They thought it was maybe her blood pressure. They did the exams, nothing. Then they are like, well, maybe you're having a migraine. They gave her migraine medication, nothing. So I suggested, I'm like, could it be Bppv? And the doctor is like, oh yeah, it could be, but we don't treat that. So you just gotta go home. So I told my mom, go see a vestibular physiotherapist that could help you. So they did a couple of DFT maneuvers, and within 3 days, it resolved. Like, it went away. So my mother was extremely grateful for that. And I was saying, yes, these conditions often, like Bppv, can go underdiagnosed. Like people at the ER or people that don't have enough knowledge about it don't diagnose it. So the patient goes home like, okay, now what? Like, what do I do with this dizziness? What do I do with this vertigo? So I'm very happy and very glad that you're raising awareness with this app that creates education both for the medical professionals and the patients themselves. So let's get into it now. What really is Bppv?
So we have our vestibular organs. We have our vestibular, and are you hearing echo?
A little bit, yeah.
Let me see if I can. So the vestibular organ has two components to it. You have semicircular canals, and these canals tell us about angle and movement. So every time we move our heads, those areas move little hair cells in the canals, and that's how we know if we're kind of turning left and right and things like that. The other part of our vestibular system is called the odorless organs, and these are similar, but they have one extra component. They have these tiny little crystals in them, and those sit on top of the hair cells. And so they act as a gravitational sensory, basically, to those hair cells. So now if you are upside down, those little crystals would fall off the hair cells. You're upside down. Right way up, they give you that sense back again. So what happens with Bppv is those tiny little crystals end up breaking off. And this is normal. They always break off throughout our whole life. So the breaking off is the normal aspect of it. But normally when they break off, they just fall in that organ and get absorbed. But what happens with Bppv is that, let's say when those crystals broke off, you just happened to be sleeping at night and your head was back and maybe to the side. Now, when they break off, they can easily fall into one of those semicircular canals. When they do that, there's now this component to the semicircular canals that isn't supposed to be there. So now when you go and move your head, which triggers the semicircular canals, they're getting this extra signal from those little crystals, and it's an error signal. And that results in us feeling spinny, but only really when we're moving our head in certain ways. When we're still, error signal goes away. We're not feeling it. And so it's really specific to actual motion. And that's why with Bppv, we really kind of want to tease out, are you dizzy with head movements and motion, but you feel okay at rest? That's a really classic kind of presentation of it. Now, the error signal, people are like, okay, Bppv, vertigo is literally in the name. It's benign paroxysmal positional vertigo. I have to have vertigo to have Bppv. But when you look at the literature, vertigo is not even the top symptom that people report with Bppv. Being off balance is the first symptom that people report. Then vertigo is second. And neither of them are even breaking the 50% range. So only at most, 50% of the people are actually reporting vertigo who have true Bppv. And so that is a huge, I think, take-home message for people, because so often people go, it's not Bppv, I don't have vertigo, I feel imbalanced, or I feel lightheaded, or it's dizzy but there's no movement of spinning, or it's nausea, or it's so many different things, right? We know that there are so many ways that it's really how our brain interprets that error signal and how that's presented for the person. And so it's really easy to kind of slough off somebody as not having Bppv if they don't tell you they have vertigo. So huge take for that guy. So that's kind of the error signal that happens. And what we do in therapy is we first figure out, okay, well, there's two canals that those crystals can fall into. 3 technically, but really 2. It can either fall into your posterior canal or your horizontal canal. And so we first look at which canal is the problem. And then we have to figure out, how are those crystals in the canal? Are they just floating, or have they actually kind of gotten stuck to the canal a little bit? And so there's 4 different types of Bppv then as a result of where it is and how those crystals are. And so that's why it's so important to understand, not that you have Bppv, but what type of Bppv do you have? And that's why the epi doesn't work for everybody. And it's not the only solution. So as vestibular therapists, our job is to figure out the type of Bppv that they have and the location, and then from there, which maneuver. And there's actually 4 different maneuvers then that are going to potentially work. And so that's kind of the role of the vestibular therapist. And that's basically what I did in the app, is put that, break those things. Yeah. And awesome. Put that together. Yeah.
Doctor, you mentioned, which is extremely accurate, that as we get older, more people experience BPPV. A lot of the elderly people that I know, they complain. And you're right. Like they don't always say they have vertigo. They sometimes say they say I feel like air in my head. Like my head is like full of air, so I feel like headed almost. Or they feel off kilter. They're like I feel like off balance, but I'm not spinning. So how come that the elderly experience more often BPPV? What's the reason?
Yeah. So remember, talk about those little crystals. So those little crystals that are adhered onto or that sit onto those hair cells in that one organ, our odorless organs, they're not just sitting there. They're actually kind of, held in place. There's little microfilaments that hold those crystals in place. And those crystals themselves are little tiny bones. As we age, what we're seeing is that those little microfilaments will actually start to break apart, as well as bone just kind of starts to, as we age, bone changes. And so there's a link not only with age, but with osteoporosis, where the bone itself is a little bit now more weaker, has a little more like kind of holes in it, or you've got vitamin D deficiency where the bone itself is being affected. And so what happens as we age is that those crystals either start to break apart a little bit or the microfilaments break apart. And so really it's more crystals are breaking free. And so it's a numbers game. So when you're younger and everything is solid and you've got everything adhered well, yeah, you might break some loose, but it's just there's so few that are happening that are breaking loose when you're younger. So that's why we don't see it as often in younger people. But as we age, we just see changes from age, and you're just dealing with more crystals breaking free. The more that break free, just the higher chance that some are going to fall out of the normal organ and into those semicircular canals.
Yeah. Doctor, now, not only age, but I've also known that traumatic brain injuries, concussions, a hit to the head could also cause BPPV.
Yeah.
Is the reason why? Is it because a big knock to the head might loosen up these little crystals and then send them to the other canals where then it triggers these symptoms?
Exactly. So we don't know for sure, but that's basically the theory behind it, is that an actual trauma just knocks those crystals. So whether it's actually breaking crystals off or those loose crystals that were already kind of loose anyways, end up being knocked like into a canal. Exactly. That's the theory, is that they're getting knocked in. And that's kind of really the most common way that we're seeing BPV in younger people, is with those traumatic brain injuries, car accidents, concussions. And it's so important to also screen for BPV with concussions. I've had patients come to me who've undergone concussion rehab for over a year with other therapists. They've plateaued. They just don't, they're like, I don't know what to do anymore. They come and they see me. It's just sort of like somebody else to see. Let's try something different. And on the first day, I'm like, let's check for BPV. And they have BPPV. And the whole time they've had BPPV. We treat the BPV. The concussion systems that are left are gone. Like what was left was really the BPV symptoms. But like we know, BPV presents so differently in everybody. They weren't always reporting spinning. They were just feeling off balance. Or so many concussion symptoms are so similar. Yeah, and so it's a huge thing that I think a lot of concussion therapists are now recognizing, like, we got to be screening for BPPV with everybody that comes through, because it's so common.
Yeah, doctor, now, if let's say someone is experiencing symptoms of BPPV and they don't treat it, they leave it alone, is there a chance that it may go away on its own, or it will just continue be there in the background until somebody actually helps them adjust these crystals?
Yeah. So that's a bit of a 50-50. So 50% of people, it will go away on its own. So there are certain cells in our body that are absorbing cells. And we have a lot of those in the odorless organ that normally where those crystals live. Because they know, the organ's like, yep, we're going to lose some crystals all the time, and I'm here to catch them and absorb them. So we also have those absorbing cells in the semicircular canals. There's not as many of them, but they're there. So two things can happen. So those crystals might actually just get absorbed in the semicircular canal on its own, Or we might actually just move our head in a way that moves those crystals back out. Because that's what we do with the maneuvers. We are moving those crystals back out with a specific head movement. But, you know, you might move that way. You might just bend over. You might roll over in bed. It's really, people can sometimes just move their head in a way that moves those crystals out of the canal. So we look at the statistics and the research shows about 50% of people, 40% probably more accurate, will actually get spontaneous recovery, we call it. And so that means that either it's been absorbed or they've moved back out. But the average duration is over a month before that will actually happen.
Yeah.
So
for a month.
Yeah. Why wait a month and have a 50-50 shot at actually going away versus doing something about it, right?
Yeah.
When we know 1, maybe 2 treatment sessions has like a 90% efficacy. So, you know, two maneuvers, each maneuver takes about 5 minutes. So maybe in like 10, 20 minutes, we can get resolution, you know? So it's huge difference between treatment and waiting. Yeah.
Yeah. Doctor, a question that I get asked often by people is, if I had BPPV, could it come back?
Oh, totally. So that's the thing about BPV. We need those crystals. They're a very important part of our anatomy. And so all we're doing when we treat BPPV is just moving them back where they should be. Now they're going to get absorbed, but there's a couple things to keep in mind. So when we move those crystals back, it takes time for them to get absorbed. It might take a day or 2 for them to actually absorb into the body. So we really kind of want to be cautious about, you know, the very right away, right? You might get BPV coming back the next day or within a few hours if you go and you do a yoga class and you put your head upside down or things like that. So within the first day, sometimes we kind of say, you know what, let's just give time for those crystals to absorb. So there's that immediate reoccurrence risk always when you treat BPPV, but there's always just the reoccurrence risk after because we're still losing crystals. It's normal. We have to be losing them. It's part of what we do. And again, if you're getting BPV when you're older, it's a numbers game. You know, it can happen again. And so the research is showing like a 40% chance of reoccurrence within that first year. And so that's kind of where, as a vestibular therapist, it's so important to make sure people know that and understand like what to do if it comes back. And everyone's different. So some people are going to want to be like, I want to come and see you. I want to do exactly what we did today, hands-on or over Zoom, but I want to have access to my therapist. Some people might be really good being like, I want to learn this maneuver. If it comes back, odds are it's going to come back in the same canal and it's going to be the same type. So we talked about there being 4 types. You're probably going to have your type come back again. That's kind of what we see most often. So if you just understand how to do the maneuver for yourself of what works best for you, then if you have the vertigo come back or whatever your symptoms come back again, we really encourage people to sort of take it on themselves and to be independent with this diagnosis and learn how to actually manage it themselves. Because first off, it can get very expensive to have to go in and see a therapist every single time. But also, what if you want to go away? What if you want to go on vacation? What if you want to go to a cottage or go down south or do what I'm doing and hop on a boat for a year or do whatever? There's a lot of patients who told me, they're like, well, what happens if it comes back? Like, and before I was like, well, here's a piece of paper or come and see me. And so that's kind of, again, where we're trying to drive up the resources for people on management of it independently. And, you know, it's part of the therapist role to make sure people really feel comfortable with treating it on themselves, like recognizing it and then attempting to treat it on their own. And then knowing if that doesn't go, we're always still here, right? Our vestibular therapists are always still here, but it can be very limiting for people sometimes. That reoccurrence stat can change someone's approach moving forwards in their lives, and I've seen it be a little bit debilitating. They don't have BPV, the knowledge that it can come back can be debilitating and can be limiting, and there can be anxiety around it and fear.
Yes.
So
Yes.
it's so, and that was again another role of the app is like, well, let's give somebody a better resource tool than this piece of paper that they're gonna lose, because we all lose pieces of paper. And so that was part of the other thought in my mind is like, just we need people to feel like they have control of their lives. And you yourself have gone through vestibular rehab, and I'm sure you have an understanding now of your diagnosis and how to manage it. And you don't want to have to reach out to a therapist every single time something goes wrong. It's the same for BPV. We want people to manage it. And if you need the therapist, it's there, but it shouldn't be the first thing, I don't think, when a reoccurrence comes back. I think it's up to the patient. You're going to have still people who want the first rule as go to see your therapist, but it doesn't have to be for everybody. If somebody is a more independent person who wants a bit more freedom and knowledge of their own condition, I think this is a really good condition to be able to tackle potentially.
Yep, you're giving the power to the people by educating them properly, because you don't want to give people power without the education. So you're actually educating them in order for them to be more confident with how to treat the condition. That's great.
Exactly.
Doctor, as you know, there are many vestibular conditions: Bppv, triple PD, vestibular migraines, Meniere's disease, vestibular neuritis, and many more. Could there coexist one of the, let's say, vestibular migraines, could it coexist with a case of Bppv that happens to me out of the blue, or they just are not related at all?
Yeah, so there is, like, if you look at the research, absolutely. And so we see Bppv more often if you have another vestibular disorder. And the reason for this is, remember I was talking about those cells that absorb the crystals naturally? We actually see changes in those cells. So they don't absorb crystals as effectively when you have another vestibular condition going on. And so if those cells aren't absorbing crystals as efficiently, there's more crystals loose, which means Bppv rates go up. And that's really how we're correlating the two things, is there is that connection. And so everybody who comes through my door, whether their diagnosis is BPV or not, you want to make sure that they understand that, like, okay, here's what we're working on. But if your symptoms change, if all of a sudden you're getting positional based symptoms, whether it's vertigo or imbalance or something like that, it's important to educate everybody that this condition, your rates are a little bit higher, not to be scared of it, but to just be aware of your symptoms. And if they change, come and talk to your therapist. And I think in that situation, the therapist definitely should be involved. You want somebody to kind of be working through differentiating your disorder versus Bppv. But on the patient kind of needs to be aware of addressing and vocalizing changes in their symptoms. Because as therapists, we're not going to screen for Bppv every time you come in. So patient needs to understand that, like, hey, if something's different, talk to your therapist about it, because it could be Bppv. It's really easy to just say, oh, maybe I'm having a flare up of a migraine. I'm having, my Meniere's is a little different this round, or whatever. Like, it's so easy to just put all your symptoms on your diagnosis and forgetting that it might not be. It might be something else that you should be conscious of. Yeah.
Doctor, what does the future hold for Dr. Cheryl?
So we are still on the boat. My hope is to actually sail back up to Canada next year. So we're going to bring the boat back to Canada. We think it's time. So we're going to be doing some big sailing next year through a pandemic, which will be interesting. So we'll see how that goes. But from a professional standpoint, my hope is to still continue to really advocate for Bppv and advocate for management of it in those rural areas and at different cost options for people. So really trying to continue that mindset. The telehealth is going to ramp up as we sort of, build that area as well. So everyone in Ontario will be able to still continue to get treatment, but maybe try to get into other provinces. And then just we'll see what happens from that point on. But yeah, that's kind of the next year.
I am originally from Colombia, so if you're boating down there, there is an island off of Colombia called San Andres Island. If you see it, it's beautiful. It's gorgeous.
Okay, and I have friends there right now, so I'm going to tell them about that island and tell them to get over there and visit it.
That's good.
Awesome.
Doctor, where can people find you?
So I can be found on Instagram and Facebook under Healing Vertigo, website healingvertigo.ca, and obviously the VITA Healthcare Provider Directory as well, where you can kind of get all of my information to connect. And if you're looking for the app, it's also called Healing Vertigo, really easy, all the same name. And it's on Google Play and the App Store if you're looking either as a patient or a healthcare provider for that app.
That's awesome. My last question to you, Doctor, is this channel is called Find Your Chappiness, which means find your happiness. So how does Dr. Cheryl find her chappiness?
Oh, it is getting outdoors. It is just taking in nature, whether it's sailing, it's being back home in Canada on a mountain bike or snowboarding, but it's being outdoors. I think whenever I'm feeling anything, if I just get outside, I feel better. I feel happier, even if it's raining and storming. I don't know, there's something about the outdoors and feeling the elements, the wind, everything around you that just, I think it just makes me giddy inside. And so that's how I find my happiness or chappiness.
That's awesome. And I actually relate to you on that way, because when I'm feeling overwhelmed by symptoms, just a simple walk in nature, even just feeling the grass in my feet, like taking my shoes off and feeling the grass, like it just grounds you again. You just feel like okay, it's gonna be okay. It's gonna be okay. So I agree.
Oh, I agree. There's something about like increasing all that sensory input, the wind and the sun and the ground and everything. Like we're just getting all this great stuff that's on us, and it feels good.
I think we're meant to be more connected with nature, because like even right now, I have sunflowers in my garden in the back.
Yeah.
And just seeing them open up and seeing the big sunflowers and the bees around it, like it gives me such a peace inside and such joy. And my wife is like, why are you so happy? And I'm like, they're just so pretty, like they're just so beautiful.
Staring flowers.
Yeah.
Love it.
All right, Doctor. Well, it's been an absolute pleasure talking to you. You have a friend now here in Calgary, and I love your story of adventure, going on a boat for a year, traveling the Caribbean. That's amazing. So yeah, awesome. Stay safe, keep happy, and then we'll chat soon.
Absolutely. So great seeing you.
Bye. Ciao.